1. List the common behavioral disorders of infant. Answer. Infancy is the period from birth to 1 year of age. Behavioral problems. Resistance to feeding or impaired appetite. Abdominal colic, stranger anxiety, or separation anxiety. 2. Define social phobia. Answer. Social phobia is a mental health condition that causes someone to experience intense and persistent fear and anxiety in specific or all social situations, as well as sometimes everyday tasks like eating or drinking in front of others. Physical signs and symptoms include pounding or faster heart rate, shortness of breath, sweating, tremors or shaking, headaches. 3. Mention the types of tics. Answer is tic or habit spasms are sudden voluntary repetitive meaningless movements of voluntary muscles. Types of tics are motor tics. These include tics such as head and shoulder movements, blinking, jerking, banging, clicking fingers, or touching things or other people. Vocal tics. These are sounds such as coughing, throat clearing or grunting, or repeating words or phrases. Simple tics. These are sudden and fleeting tics using few muscle groups. Examples include nose twitching, eye darting, or throat clearing. Complex tics. These involve coordinated movements using several muscle groups. Examples include hopping or stepping in a certain way, gesturing, or repeating words or phrases. 4. Mention common speech disorders of children. Answer is speech disorders are common in children. Speech disorders are stuttering or stammering, cluttering, dyslalia, delayed speech. Stuttering or stammering. It is interruption in the flow of speech and spasmodic repetitions. Cluttering. It is unclear and hurried speech, in which words tumble over each other. Delayed speech. It occurs beyond 3 to 3.5 years. Dyslalia. It is the most common disorder of difficulty in articulation. 5. Enlist 2 ill effects of thumb sucking. Answer is thumb sucking is a habit disorder due to feeling of insecurity and tension. Ill effects are malocclusion, malalignment of teeth, difficulty in mastication, difficulty in swallowing, deformity of thumb, facial distortion and speech difficulties. 6. Define juvenile delinquency. Answer is juvenile delinquency is the participation by a minor child, usually between the ages of 10 and 17, in illegal behavior or activities, or the behavior of a minor child that is marked by criminal activities, persistent antisocial behavior, or disobedience, which the child's parents are unable to control. 7. Define pica. Answer is pica is an eating disorder that is characterized by eating items other than food such as paint chips, dirt, paper, or hair. The symptoms may include nausea, pain in the stomach, or abdominal cramping, which can indicate that there may be an intestinal blockage, constipation, diarrhea, stomach ulcers, which may cause blood in the stools. 8. Write the meaning of enuresis. Answer is enuresis is the medical term for bedwetting. Bedwetting happens when a child urinates in their bed at night while sleeping. Symptoms are chronic incidents of bedwetting, incidents of wetting at least twice per week for a period of 3 months, wetting incidents involving clothing. 9. Mention 4 predisposing factors of conduct disorders. Answer is conduct disorder is a type of behavior disorder. It's when a child has antisocial behavior. Predisposing factors are impulsiveness, low IQ and low school achievement, poor parental supervision, punitive or erratic parental discipline, child physical abuse, parental conflict, disrupted families, antisocial parents, large family size. 10. What is the formula to measure intelligence quotient of children? Answer is an intelligence quotient is a total score derived from a set of standardized tests or subtests designed to assess human intelligence. Formula of IQ is 11. Write the meaning of infantile autism. Answer is infantile autism is a developmental disability characterized by onset of disturbances in social and language development before the age of 30 months. Symptoms are reduced eye contact, lack of response to their name, or indifference to caregivers. Other children may develop withdrawn or aggressive, or lose language skills. 12. List any 4 welfare services for challenged children in India. 4 services for challenged child. National Institute for Orthopedically Handicapped, Kolkata. National Institute for Mentally Handicapped, Secunderabad. National Institute for the Visual Handicapped, New Delhi. National Institute for Rehabilitation, Training and Research, Cuttack. 13. Mention 4 behavior modification techniques for children. Answer is behavior modification is defined as the alteration of behavioral patterns through the use of such learning techniques as biofeedback and positive or negative reinforcement. Behavior modification techniques are positive reinforcement, negative reinforcement, positive punishment, negative punishment. Example of positive reinforcements. If your kids eat all their dinner, they might be rewarded with a great job eating and a bowl of ice cream for dessert. Example of negative reinforcements. Making a child do homework during recess because they forgot to do it at home. You explain that keeping your room clean is your responsibility. You then give him another room to clean as well as his own, so he can practice cleaning. Example of negative punishment. Your high schooler talks back to you, so you remove all electronics from their room that they love. 14. Mention the services of Child Guidance Clinic. Answer is services of Child Guidance Clinic. Managing the behavioral problem. Managing learning difficulties. Managing emotional problems. Managing adjustment problems. Managing socio-legal issues. 15. Define physically challenged children. Answer is physically challenged child ID, defined as a disadvantage for a given individual resulting from an impairment or a disability that limits and prevents the fulfillment of a role which is normal for that individual.